Hello to all students. In this video lecture, we are going to discuss psoriasis. Psoriasis is a medical condition related to the skin of human beings. And at this time, psoriasis is not curable. But there are certain medications available which we can use to treat or control this disease. To understand the concept of psoriasis, first of all, we have to look at the structure of skin. Our skin is composed of an upper layer which is known as epidermis. Just below the epidermis, there is a dermis layer which contains blood vessels and glands. In the epidermal cells, usually our skin replaces old worn out cells and produces new cells to make new skin during different weather conditions. But it usually takes 7 to 8 days to make new cells. But during psoriasis, our skin cells do more mitosis or cell division and rapidly within 24 hours to produce more skin cell due to certain condition like psoriasis. In this condition, the upper layer of the skin, which is known as epidermis, becomes inflamed and scales like flakes peel off from the skin, and you can see in the form of small scale appearing on the surface of the skin. So this is the most important sign of a psoriasis. So what are the major symptoms of psoriasis? Number one, a patchy rash like dandruff. Just like dandruff in hair, small patches or scales peel off from the skin in the form of a rash. Small scaling spots appears on the surface of the skin. Skin become dry, cracked and sometimes bleed. Itching, burning and soreness can also occur on the surface of the skin. So these are the most important signs of psoriasis. So there are different types of psoriasis depending upon the type of the patient and condition of the patient. Plaque psoriasis, which is number one psoriasis, which occurs 80 to 90% of the patient. During this condition, the upper surface of the skin becomes plaqued and small scale like skin patches drop off or peel off from the skin. The second type is nail psoriasis, which usually occur at the nails of hands and feet. During this condition, nails become brittle and their contact with the skin loses and nails fall off. So this is also a very severe condition of psoriasis. Guttate psoriasis usually occur after the infection of throat, which is known as sore throat bacterial infection, and it appears as drops in the form of drops on the surface of the skin. That is why it is called as guttate psoriasis. Inverse psoriasis occurs in skin folds like armpits, groins and other parts of the body where skin has been folded. So in the folds, psoriasis takes place. Pustular psoriasis contain pustules. Pustules are small vesicle-like structure formed on the surface of skin which filled with pus, and sometime when they rupture, pus comes out from the skin. Erythrodermic psoriasis is a more severe form of psoriasis which usually covers 90% of your body's skin. So it is a severe condition of psoriasis. Now we are going to discuss what are the causes of psoriasis. There are no known causes of psoriasis. Exactly, we don't know what is the real reason, but scientists believe that it is due to autoimmune disorder. Our body has a defensive system which is known as immune system, which fights against infections from bacteria, viruses and certain other microbes. But sometimes due to some issues like genetic mutation, our immune system attacks our own cells, and in this condition psoriasis can be produced in our body. So psoriasis can be produced as a consequence of autoimmune disorder, just like the other diseases like lupus or some other autoimmune disorders. Immune system problem is the major cause of psoriasis. Genetic is also major cause of psoriasis. Environmental factors can also lead to psoriasis. But most importantly, there are some triggers which worsen psoriasis. So we have to look for those triggers which are making psoriasis worse in our body. So some people have infection in the body which can cause psoriasis, which can trigger psoriasis. Weather conditions, certain weathers like summer, winter, autumn, etc. may also trigger psoriasis. Certain medication including lithium, intake of lithium and some other medication may cause psoriasis. Stress, hormones imbalance, especially at puberty when there is more production of hormones, may also lead to psoriasis. Sunlight, ultraviolet radiation can also lead to psoriasis. Skin injuries can also trigger psoriasis. So we have to look at these triggers which are going to worsen, and we have to stop them and to control them so that we do not have any severe kind of psoriasis condition. Psoriasis does not have any cure, so we have to only control it by treating with some certain medication. First of all, you have to see a dermatologist, which is going to perform some test. After confirmation that it is a psoriasis, then certain medications can be used to control it. So what are those medications? Number one, steroid creams can applied on the surface of the skins, which try to control the inflammation in the skins. Topical creams like roflumilast can be also used, which is used on the surface of the skin to control the infection of psoriasis. Moisturizer, if you have a dry skin, then you must have to use moisturizer all the time to keep your skin moisturized with some kind of thick lotion or cream or any ointment. Salicylic acid can also be used. Coal tar, vitamin D based creams, retinoid creams which include vitamin A. These type of lotions and creams usually are applied on the surface of skin. Their oral use is prohibited because they can cause severe side effects like kidney failure or damage to your liver. Calcineurin inhibitor and anthralin also used are applied to stop the rapid growth, mitosis of your cell division of your skin cells. Cyclosporins medication can also be used to inhibit the overactive immune system in your body, so that immune system do not significantly attack on your skin cells, which is causing psoriasis. So managing psoriasis, treating psoriasis, controlling psoriasis is the best way to treat it, because this disease does not have any cure. So take care of yourself. That's all for today.